I'm Dr. Taz Varkey. On my last episode, we talked a lot about HPV and how it's connected to cervical cancer. Today, I'd like to teach you about what you can do to prevent infection with HPV. Now, there's 3 ways you can do this. The first is to use condoms. I did mention in my last video that condoms don't prevent HPV transmission completely, but they do help. Since HPV is transmitted through skin-to-skin contact, the less surface area of your genital skin that's touching your partner's, the better. The second way is with the HPV vaccine. I already taught you that there's low-risk strains that can cause genital warts, and that there are 15 high-risk strains that can cause cervical cancer and other types of cancers. Well, of these 15 high-risk strains, there are 2 types, type 16 and 18, that can cause 60 to 70% of all cervical cancer cases. The current vaccine, Gardasil 9, protects you against 7 of the high-risk strains of HPV, including type 16 and 18. It also protects you against 2 of the low-risk strains that cause 90% of all genital warts. So, if you get all 3 of the shots in the vaccine series, you'll reduce your lifetime risk of cervical cancer by 85%, vaginal and vulvar cancers by 50%, anal cancer by 90%, oral and throat cancers by 20%, and genital warts by 90%. Let that sink in. What other vaccine could reduce the risk of this many cancers? Now, people commonly ask me, can I get HPV from the vaccine? And the answer is absolutely not. It's not a live virus, just part of the viral capsule that's in the vaccine. In fact, many people have no reaction at all. Some people get some mild flu-like symptoms, and only rarely does someone have any serious reaction due to an unexpected allergy. So now, what's the third way from keeping yourself from getting HPV? Don't have casual sex. In this day and age, when everyone is so comfortable with their sexuality, you still have to consider that even if you use condoms, there are some STIs you can still get. So don't just sleep with anyone. Ask yourself, is this person worth getting HPV and all that comes with it? If he or she isn't, keep your distance. And when you meet someone you care enough about to deal with a possible infection, then you can deal with it together in a loving relationship. So that's my 2 cents on HPV prevention. If you haven't already, please go out and get the vaccine. And there's always more to share on this subject, so please talk to your doctor if you want to learn more. Thanks for tuning in, and don't forget to subscribe.